Welcome back. In this video, we'll talk about all of the antihypertensive medications. Hypertension is caused by excessive tension in the blood vessels, which is mostly caused by either hypervolemia, which means that the blood vessels themselves are super tense because they are stretched by the volume inside, or by excessive cardiac contraction. The hypervolemia part can easily be corrected by diuretics. And these are some medications that promote diuresis. In other words, they take the volume or the water out of the blood into the urine. And in these classes, we have the loop diuretics, the thiazide diuretics, and the potassium-sparing diuretics. They are categorized in these classes because they have different mechanisms of action, but they all achieve the same effect, which is decrease the blood volume. We can also decrease the tension in the blood vessels without affecting the volume of the blood, and this is achieved by calcium channel blockers. Calcium is used in the smooth muscles of the blood vessels to contract the smooth muscles. So when we block the calcium channels, we will cause relaxation of the smooth muscles. And this translates to dilation of the blood vessels and decrease the blood pressure. And we simply have two classes, the dihydropyridines and the non-dihydropyridines. The dihydropyridines work more on the vessels and less on the heart, and the non-dihydropyridines work more on the heart and less on the vessels. We also have another class known as the ACE inhibitors. These are very commonly prescribed and they are very effective. To put it simply, we have an enzyme in our lungs known as the ACE enzyme. This enzyme converts one hormone known as the angiotensin 1 into angiotensin 2. Angiotensin 2 is a potent vasoconstrictor. So if we have a lot of angiotensin 2, the blood vessels will be constricted. And by blocking this enzyme, we will decrease angiotensin 2 and decrease the blood constriction. Again, this class is very strong and very commonly prescribed. This class also have favorable effects on the kidneys. So if somebody is having hypertension as well as some renal problems, this class can treat both. However, we can achieve the same effect of this class without inhibiting the ACE enzyme. Remember, ACE enzyme converts angiotensin 1 into angiotensin 2. And ACE inhibitors work by decreasing angiotensin 2. But we have another class known as ARBs, which simply blocks the angiotensin 2 receptors without affecting the levels of angiotensin 2. So they decrease the effects of angiotensin 2 without working the ACE enzyme. This class, however, does not have any favorable effects on the kidneys. We can also use beta blockers, which decrease the heart contraction and decrease the heart rate as well. Alpha blockers can also be used, and they decrease the tension in the blood vessels. And that's all I have. Thank you so much for watching.